What's so unique about this is before a shovel was put into the ground or a pen was put to the paper, we stopped and we thought not about building a building, but building a care environment, a caring environment. And the only way we were going to know what that meant was to go to patients and go to families. And patients that actually had been treated and families who had supported their loved ones through treatment and ask them, what did you need when you were being cared for? And what worked for you and what didn't work for you? We need to know we care because we're going to build this center from the patient up. What came through very, very loud and clear were really several key concepts. The first being that patients don't want to be alone. Families don't want to be alone. They want to be able to feel and see their caregivers. They don't want to be in hallways or rooms by themselves. They want to be able to have a sight line to their caregivers. The other thing that's very interesting is they don't want their caregivers to be alone. They want to see those caregivers supporting each other and supporting them and their families together. The other thing that was very, very important was that the center feel restorative, that it obviously was a place of treatment. It had its technical component. There was a great desire for a sense of connection with life. We interpreted that to be a connection with nature, connection with light, with natural lighting. Typically, radiation oncology and medical oncology are separated, by a floor, not greatly separated, but still sort of like a stacked condo. Your radiation is on one floor, usually the basement, and your medical oncology is on another floor. And quite honestly, the patients and their families move between those floors. The providers don't. It was very important that, in fact, if anyone was going to be doing the moving, it was going to be the providers, not the patients. That they should be able to receive their care, again, in this very holistic and coordinated and healing environment. What we came upon through a very collaborative process was this very innovative, first-of-a-kind notion that we would have all active treatment on a single floor, and that floor would be the light level floor, the floor where the most light came in, where the garden would be. It was really the first time that I know of where a LINAC and the infusion, the chemotherapy, are in the same space. LINACs are heavy and they create a fair bit of complexity in that they have to be shielded, which means lots of lead and lots of concrete. And it's always much, much easier to have them dug into the ground in the basement. It's the easy option, and that's why most radiation departments are below ground in a basement. So this took a huge commitment from the hospital and from our architects. And in fact, our architects were the ones that said, we can do this, we can do it. And they essentially built and lifted this very heavy LINAC up a whole floor and built the supports that needed to be there to allow the LINAC to live in light. What I really hope happens here, and this is really central to the way I practice, is that the patients feel that they are part of the process of healing and treatment, so that patients enter this building without anxiety or with as little anxiety as possible, and with a sense of hope and with a sense of peace and with a sense of strength, and that it will be part of their wellness as they move forward with their life.